Hey, we're back. I'm your host, BKP. Good morning from beautiful downtown Blue Ridge. We're at Circuit World here, and it will be a beautiful weekend. We know we got some storms coming through, but don't let that deter you, stop you, or slow you down from getting to the mountains this beautiful Memorial Day weekend. It's now time for Ask the Doc. We want to thank Georgia Cancer Specialist, affiliated with Northside Hospital, for this segment, and we're glad to have you back, Dr. Whaley. How are you?
I'm great, and I'm glad to be back. If it rains, it's just going to pull the pollen out of the air. It's sunny 5 minutes after the rainstorm, so don't let that bug you a bit.
Pretty simple. The doctor said rain pulls pollen out of the air. 5 minutes later, sun's shining. Get on up here.
All right, do it.
How are you doing?
I'm doing great. Got my when I put my doctor thought I put my daggum flag tie on because I was so proud of Mr. Trump for pushing Rocket Man around, and I listened to you talk about Pelosi, but we don't need to talk about Trump and pushing Rocket Man around today. I want to jump all over you like a dirty shirt, and I'm going to criticize you. Can I criticize him?
Yes.
Okay, I'll begin.
Should I say, this is a recliner. Should I put my feet up and just take a...
No. You probably ought to take an aspirin. But I'll begin by saying you spoke for a while about people getting a CDL as if that's common jargon for the average guy on the street. It's a common jargon for you, and I would like to let the audience know he means a commercial driver's license for a truck. And he means that that's a degree of training beyond this high school diploma.
Correct.
And that what he was trying to say and stumbled over so badly is that, you like that part?
No, it's
is
great.
that unemployment is at an all-time low. I read yesterday that Amazon's technical center in Atlanta has 500 or so technical people there that work on their worldwide cloud, whatever that is, and they have 50 unfilled jobs that they're unable to fill.
Mm-hmm.
And they don't require that you have a college degree in computer science or something. They require that you have some degree of facility with mathematics and computational skills that you'd have to get somewhere by going and learning them. So you were talking about the CDL, and I screamed across the room, the military, because you made every correct thing about this. Technical schools here in the mountains within 20 miles in each direction where you can go take nursing courses, you can learn how to be a diesel mechanic. I know that Delta needs jet mechanics that used to go and work at Lockheed, then jump over to Delta. But you really did forget, I think, the best, easiest to follow course of training is to actually go in the military.
I agree with that.
If you can pass the mental and physical tests, you've got to be fit. Did you know that 40% of the people that go to get in the military can't pass the physical test because of their weight or their lack of fitness? But if you get in the military, they can teach you to be a jet mechanic. They can teach you to be a computer guy. There's some fellow with a high school diploma out in Kansas flying those drones over Iraq and Afghanistan. And when you've done that for 3 or 4 years, you've served your country, you've seen the world, and you're very hireable. So the unemployment's the lowest it's ever been. And they've got so many jobs out there that can't be filled, but they need, the day you got out of high school, it's not over. That's just the ticket to the next place you go to learn something. So it's a great opportunity. There's this great big balloon, and it's ready to take you up in the air, but you got to take the next step. And you hit it all on the head, except for the jargon.
Yeah, but
you forgot the military.
Yeah, but do you not think that this class, before we get into our questions, this class, there's something a little different with this class here, as far as, like you said, you take a young man or young lady that has worked on the computers, studied computers, and actually these young people know computers, don't even have to walk into a college, that know them inside and out, and some of them can even start writing code.
That's right.
That they could walk in and go to a higher level training, not quote 4 years of college, to an Amazon that will take them now.
Right on the spot. 50
right?
There's 50 high-paying jobs available today in Atlanta.
Right. And then when I said, you're right, a commercial driver's license, I couldn't be any more, you're 100% right. A commercial driver's license, okay?
Yeah. I think everybody knows what the FBI and the IRS is.
Right,
CDL is
but I think we both agree that the opportunities coming out of college to use your degree and have a job for you, or even at 2018 going across the high school stage, this is a big year for these young people.
Oh, no, I don't think it's been brighter. I don't think it's been brighter since immediately after World War II would have been the best, where everything was open to you. But this is a great opportunity. Our economy is booming. We've got a president that's standing up for us. I think that there's not a way in the world that you can mess it up unless you don't have the energy or the stick-to-itiveness. I hate to say it, but there are too many drugs out there, and the guys that are not doing the right thing, then they're not going to be successful. But I think I ran into a kid at the workout shop the other day, who's one of our local high school kids, who graduates, I guess, tonight, who is finishing his first semester at Georgia Tech in Atlanta and pitching for the baseball team.
Yeah, that's Will Shirer.
I didn't want to mention a name.
Oh, no, I know Will. No, I know his dad.
Okay, but what I'm trying to say is that if you've been watching the newspapers in the last few days, the salutatorian and the valedictorian of all of these greater Atlanta high schools, there's one of them that's never attended a class in the high school that's the valedictorian, because every class they've taken since they entered is at the college, and they get all this extra credit. So I'm gratified at the number of people at these mountain schools here who are simultaneously enrolled in the high school and in a local college and are getting college credit while they're in high school, meaning that they are going to get some education they don't have to pay tuition for.
Exactly.
So they don't have to borrow money. So anyway, the opportunities are out there.
The
you just got to want it.
Dual
That's
enrollment. Yeah, I know Will very well. I watched him pitch for years, know his dad, and I know he went down to Georgia Tech, and I know he's a left-hander, and I know that as a sophomore up in the box, we were clocking him at 91 and 92.
Well, all I'm saying is
I'm sorry, you just got me started.
Yeah, the kid's taking advantage of opportunities and was educated well enough to be able to get in Georgia Tech. I mean, that ain't chopped.
Exactly.
Yeah, the average college board down there is 1480. It's higher than it is in Ivy League schools.
Okay.
All right, let's go to work.
We can't get sidetracked no more, but we will. Are there different types of ulcers, and what's the best diet to help relieve or get rid of ulcers? I think a lot of people want to hear this.
Yeah, I think I could spend an hour on this, and I'm really sorry that my graphics didn't get through to Amanda today. But first of all, I'm going to stick. You could have an ulcer in your mouth and in your toes and everywhere else. I want to stick to what we know as heartburn and indigestion, and to ulceration within the upper gastrointestinal tract. And this is probably the most important question that we've had around here in many weeks. When I began my training in medicine in 1962, there were many people who died of acute peptic ulcer disease, ruptured, and bled to death. And one of the guys that I saw in my office about a week ago, I first met in 1969, so that's, 50-something years ago, who at 18 had a huge gastrointestinal hemorrhage, went into shock, had half of his stomach removed. Over the course of the next 20 years, he had 6 different operations for peptic ulcer and had all of the nerves cut to the stomach. And in those days, we didn't know what ulcers were caused by. Amanda, I'm going to stop you here. If you think about ulcers and think about causation, just quickly give me what you think the biggest cause of peptic ulcer disease is.
Acid.
Acid. Okay, what caused the acid? Why is the acid there? In other words, go back one step.
From the bile from the...
Okay. All right. So the lure around ulcers is that my wife is driving me crazy. I'm going to get an ulcer. If I don't get out of this job, I'm going to get an ulcer. And that used to be...
I drink too much coffee.
I drink too much coffee. Your coffee's not doing it. Your wife's not doing it. The job's not doing it. Today in the United States...
And boss. Throw boss.
Boss, no boss. 50 to 75% of ulcer disease is caused by the bacteria H. pylori. And we only knew that within the last half a dozen years or so. And the treatment is a complex antibiotic program to eliminate the H. pylori bacteria from your stomach. In undeveloped countries, and take Japan, where there's a lot of ulcers, the H. pylori is 90%. So all of these guys that were getting this surgery back in the 60s, 70s, 80s, 90s, and even in the 2000s, before we knew about H. pylori, had a bacteria in their stomach that made them make the acid that we were taking care of by cutting out the acid part of the stomach and cutting the nerves. Okay, now of the remainder of those, Amanda, so I've said 50 to 75% in the United States and Canada as of right now is caused by the H. pylori H. pylori bacteria. There's a single cause of almost all of the others. What is it? Advil. Non-steroidal anti-inflammatories of all types. Aspirin and non-steroidals.
Any NSAID.
NSAID. So that's the next 25 to 35%. And then there's only 1 or 2% that are caused by early cancer, smoking, other types of infection. There is an acid hypersecretion type of ulcer that's not related to NSAIDs or related to aspirin. It's less than 1/2%. But unfortunately, in the young population today, there's about 3 or 4 or 5% of ulcers, more in your age group than in ours, that are caused by the drugs. Cocaine and methamphetamine, when they're raising your heart rate, constrict the blood vessels to the stomach, and they just cut off the blood to the mucosa, and a normal amount of stomach acid can cause an ulcer. So really, 98% of the ulcers are due to those two things, H. pylori and NSAIDs, and a proper diagnosis is absolutely mandatory, and there is no diet that helps peptic ulcer disease. It has to be a diet that doesn't have aspirin and non-steroidals in it. And the treatment of the disease today is non-surgical. Even if you have an ulcer that's bad enough to perforate, what they do is they go in there and sew up the ulcer, make a few biopsies to see if you've got H. pylori, and then if you've got H. pylori, they treat it, and then otherwise they go back and start taking a big-time history, and you've taken non-steroidals or taken aspirin, and they give you Zantac or even things you can buy over the counter, and it's a totally curable disease. What else?
Oh, next.
Is that enough? Okay, Amanda, did you learn anything? So your boss cannot give you an ulcer, all right?
I don't know about that.
Drinking coffee won't give you an ulcer. But if you are taking, if you take an Advil every day.
Yeah, he leads to the headaches that lead to the NSAIDs.
Now, I'm not going to stop that a bit. I will not argue that point a bit.
I thought we were done with that subject.
Right.
I thought we were moving on.
Okay, all right.
Somehow I don't know.
All right, but let me go back to let me go back to Dr. Tidman sitting here. If you have the warning signs, the alarm features, if you have heartburn, that makes you say, don't go and buy yourself some Zantac. 1, an unintentional weight loss. Go see the doctor. 2, swallowing gets harder and harder. That's a warning sign of esophageal cancer or stricture, which can occur from gastroesophageal reflux. If you have painful swallowing up in here, if you vomit, or if you have episodes of vomiting, if you feel like, this feels funny, I think I can feel something in my stomach, don't stay around and take the Advil. And if there's any family history of esophageal, gastric, or duodenal malignancy, or a history of colonic malignancy, or pancreatic malignancy in your family, then go to the doctor before you go to the Zantac. Because Tidman would have told you to go see your family doc, and then I got into causation. So once again, you got indigestion, go take a few Zantac, stop taking aspirin and Advil and stuff, and if you're totally cured in a week, then it was non-steroidals, and don't particularly worry about it. But if it becomes progressive and you're losing weight or whatever, go see Tidman or somebody. All right.
But I want to move to the last one, and then we'll go back to the middle because
Are you going to skip around?
Well, I know you're prepared no matter what direction I go in, Dr.
All
Whaley.
right, though.
What is the best treatment for a bone spur?
I am so embarrassed that our things didn't show up
We
today.
can see it. We can see that.
Can you see that? Okay. Well, that is a cartoon of a body, and you'll notice that there is a black mark up here on the neck, both hips, low back, all the joints of the hands, the knees, the sort of the place where you get a bunion in your toe there, and back on the heel. So when you talk of a bone spur, you got to tell me which one of those many bone spurs are you talking about? Okay. Now, most people are talking about a bone spur when it's on their heel.
Right.
Where when you take the fleshy part of your heel, I won't put my foot up there, but if that's your foot and you mash right there and it hurts like the devil, that's a heel spur, and that's part of the apparatus that operates the bottom of the foot, the plantar fascia, your calf, and your Achilles tendon. The way you treat plantar fasciitis, heel spur, Achilles tendonitis is basically like we did before, rest, ice, blah, 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 blah. And then there's a series of stretching exercises and so forth that you do, and virtually never does a heel spur require surgery. And there have been so many guys that have made so much money off of cutting your heel and going in there and shortening the heel spur. Heel spur is just God's way of responding to a lifelong walking on your feet and jogging. And the best treatment for the heel spur then is get the inflammation out of it by the ice and the rice and maybe the non-steroidals, learning how to do the plantar stretching exercises and stay away from a knife. There are situations. I ran the Boston Marathon with a heel spur one time, and my sports podiatrist made me a pad with a donut in it that went over the heel spur. The night before, he blocked the nerve in the back of my ankle so that I couldn't feel the pain, like going to the dentist and having a pain shot given here to operate on a tooth here, and he injected that heel spur with cortisone. Now that's stupid. I'm stupid, and I should never have done that. But I did run the Boston Marathon with an acute heel spur. Now I did fine, but for the next 2 weeks I couldn't hardly walk. So don't do that.
I wasn't planning the Boston Marathon, so
and a good
time I'm going to listen.
Okay, and a good sports podiatrist can teach you how to and actually building orthotics and increasing the biomechanical stability of the foot. There's bunches of things in the way of prevention, but heel spur is a natural part of living. When I hang that back up there again, Amanda, can you still see that?
Yeah.
There's nobody in this room that hadn't had pains right there in the back, that hadn't got some sort of swelling in this joint right there, some sort of swelling down there and where their great toe is, and all of us walk around here like our knees hurt. So every one of those places have got spurs, but the most common one when people say spurs is that one on the heel.
You ran the Boston Marathon?
8 times. Ran it 8 times. Ran it one time with a torn hamstring. I ran it one time with 3 broken ribs. I ran it 5 times without an injury and 3 times with an
I was just getting ready to say, how many times did you run it?
I ran 19 marathons.
Okay.
Crazy, huh?
No.
Go ahead.
Okay, I've been taking antibiotics for a week for upper respiratory infection, and I'm not getting much better. Is there anything I can do to help speed up my recovery?
You can tear pages off the calendar. Did you like that one? Tear pages off the calendar. You remember when we used to have calendars that had a new page for every day? I mean, you may be too young because your calendar's on your phone now. Well, anyway, the answer to that question is basically no. Basically no. You have defined by saying I'm taking antibiotics and I'm not getting better, the episodic viral upper respiratory thing. We're just coming out of this huge epidemic, which, by the way, is not totally over yet. We're going into the pollen season, and the antibiotics aren't going to help. And if it's really a sickness and you've got a temperature of 99 and 100 and you're coughing up green goo, stay home. Don't go around anybody where you're going to make them sick, and have a little rest. Fluids, gargle hot salt water, take 2 aspirin, and call me in the morning, you know.
Oh, I understand it all too well. I had that a couple of weeks ago.
No, you can't do anything.
For people that are still suffering from allergies, would it be easier? Could you possibly build an immune system from just staying outside all the
Okay,
time?
yes, that's a really great idea. First of all, remember that we have taken our children and protected them so much from exposure to dirt that they have an increased amount of allergies. And months ago, we talked here that they recommend that you expose your children to everything. Let them play with puppies, play with kittens, go outside. You know, my dad used to say you have to eat a peck of dirt before you're 10. I don't think people eat a peck of dirt anymore, but they don't even know what a peck is, do they?
I was just getting ready to say, Dr. Whaley, you just threw a peck of dirt on them, and they're wondering.
Anyway,
If
you go over to Sears and buy apples, they'll sell it by the peck.
I'm with you, sir.
Yeah,
I
okay.
understand.
It's a country way of measuring stuff. But anyhow, yes, that is absolutely true. That when you move to a new community, you get an increasing amount of allergies, and then you get better over a course of time. That's just really sort of a natural biological, what the allergist does when he gives you allergy injections. What he's doing then is he's taking what's the big one around here, ragweed and so on, these trees, and then taking that pollen and getting the serum out of it and starting with a low dose and building it up. So yes, you can. And it's really safe this time of year to take one of these over-the-counter generic Claritins or Zyrtex, and you can take it every day, and there's not a reason in the world not to do it. And if you get the generic ones at the Costco and the Walmart, they're cheap as dirt. And if you buy the ones that got the brand name on it, they're expensive.
So you, let's see, we've talked about the marathon that you've run several times with
injuries
several times, and then you went to Peck. You threw Peck in this show.
Yeah, okay. Good.
So do the mom and dads, do they not sing to the kids anymore? I love you, a bushel of peck and a hug around the neck.
Peck and a hug around the neck.
Right?
I don't know. If I don't even know what they're singing about anymore.
Dr. Whaley, it is great to have you back, and glad to have you and Jane home, and we're glad you went and enjoyed. We appreciate Dr. Tidman for coming in when you're not with us, and we're glad you got an opportunity to enjoy some time away. You got any closing, parting
I got 2
thoughts?
Yeah, listen, I want you to listen carefully. Study came out yesterday, once again, studying a homogeneous population, and those are always in Sweden, Norway, Finland. A 20% above ideal body weight for women increases their chance of getting heart disease heart attack by 18%, stroke by 28%, and cancer by 20%. Now, we've always been talking about, they need to be lean and exercise, but that was the first time I've seen a chart that gave those 3 things out of there. That was one. Second study that came out yesterday, again from a homogeneous population. It's just exactly like the one in Blue Ridge, China. But anyway, the things, yeah, there's not too many Chinese around here, but everybody's worried about eggs. The eggs are hurting me. You say eggs are hurting me. The people who ate 1 egg a day versus the people who ate very rare eggs, the ones that ate 1 or more eggs per day had a much lower incidence of heart disease and stroke than the ones who didn't, because the major sources of cholesterol and fat in the diet are not eggs, and eggs have great nutritional value. So you can eat your 2 eggs every morning. They're low in calories and high in protein. As I've said before, 2 eggs a day have all the essential amino acids it takes for metabolism, not all the protein you need for life. How's that? Got that one?
You know what I heard on the news this morning is obviously we've labeled it junk food. In the grocery store, some things junk food, but they're actually going to looking at putting warning labels on certain food, just like cigarettes.
Well, they're doing it in San Francisco.
Are they?
Yeah, that's not a joke. San Francisco. Well, excuse me. They've passed an ordinance that they put warning labels on sugar-containing sodas.
Right.
That was the first one, and there's a suit against them saying you don't have the power to do that in a localized environment. But you're exactly right. And I think in some countries they may already be doing it. I'm not sure. But
Dr. Whaley, we appreciate it. We want to thank Georgia Cancer Specialists affiliated with Northside Hospital. We appreciate them very much for this segment. If you have a question for the doctor, info at fetchernews.com. Just put up there in the subject, Ask the Doc, and we try to get our questions over to the doc every week, and maybe they'll be answered right here on the show. And I do know when Dr. Whaley's in town, we send him questions. If he can't get to them on the show, he does respond where we can get you an answer. Info at fetchernews.com. Ask the Doc. Again, thank you, Dr. Whaley. Enjoy this 3-day weekend and beautiful weather that's coming our way. We're going to take a break. When we get back, Rick and I are going to talk about some political things that took place throughout the week. And
no jargon.
No jargon. Okay. Right after these messages.